as add-on therapy? A. Pioglitazone, B. Empagliflozin, C. Saxagliptin, D. Sulfonylurea. Answer: B. Explanation. SGLT2 inhibitors, empagliflozin, are recommended in patients with type 2 diabetes and HFrEF due to cardiovascular and renal benefits. Pioglitazone is contraindicated in heart failure. Page 525, CTC 2018. Q2. A 58-year-old woman with type 2 diabetes mellitus is on metformin and sulfonylurea. HbA1c remains 9.1%. She has significant weight gain and hypoglycemia. Which add-on therapy is best? A. Insulin. B. GLP-1 receptor agonist. C. Another sulfonylurea. D. Thiazolidinedione. Answer: B. Explanation. GLP-1 receptor agonists lower HbA1c, promote weight loss, and reduce hypoglycemia risk compared to insulin or thiazolidinediones. Page 523, CTC 2018. A patient with diabetes and an eGFR of 25 mg/min requires additional glucose lowering. Which therapy is most appropriate? A. Continue metformin. B. Start SGLT2 inhibitor. C. Start linagliptin. D. Start acarbose. Answer: C. Explanation. Linagliptin is a DPP-4 inhibitor not renally cleared and can be used safely in advanced kidney disease. Page 528, CTC 2018. Q4. A 72-year-old woman with diabetes has recurrent hypoglycemia at night despite basal insulin. Which adjustment is best? A. Increase basal insulin. B. Switch to premixed insulin. C. Reduce basal insulin dose and adjust mealtime insulin. D. Add sulfonylurea. Answer: C. Explanation. Nighttime hypoglycemia suggests excessive basal insulin. Dose adjustment and meal insulin titration are recommended. Page 534, CTC 2018. Q5. A 45-year-old man with type 1 diabetes is planning to switch from multiple daily injections to insulin pump therapy. What is the main advantage? A. Decreased need for blood glucose monitoring. B. Reduced hypoglycemia and more flexible lifestyle. C. Complete elimination of bolus insulin. D. Permanent cure of diabetes. Answer: Explanation. Insulin pumps reduce hypoglycemia risk, improve HbA1c, and provide flexibility. Monitoring is still essential. Page 536, CTC 2018. Hush. Q6. A 60-year-old man with diabetes has neuropathic pain. Which agent is most suitable as first-line therapy? A. Ibuprofen. B. Gabapentin. C. Morphine. D. Insulin. Answer: Explanation. Gabapentin or duloxetine are first line for painful diabetic neuropathy. NSAIDs and opioids are not recommended. Page 540, CTC 2018. Q7. A 55-year-old man with long-standing diabetes presents with erectile dysfunction. Which of the following is the most appropriate first-line therapy? A. Testosterone replacement. B. Sildenafil. C. Vacuum erection device. D. Yohimbine. Answer: B. Explanation. Phosphodiesterase 5 inhibitors, e.g. sildenafil, are first line for erectile dysfunction in diabetes. Page 541, CTC 2018. Q8. A 63-year-old woman with diabetes presents with gastroparesis. Which therapy should be avoided? A. Insulin. B. Metformin. C. GLP-1 receptor agonist. D. Domperidone. Answer: C. Explanation. GLP-1 receptor agonists delay gastric emptying and can worsen gastroparesis. Page 540, CTC 2018. Q9. A 70-year-old man with diabetes on insulin presents with confusion, sweating, and palpitations. His blood glucose is 2.4 millimoles per liter. What is the best immediate treatment? A. 50 milliliter IV dextrose, 50%. B. Subcutaneous insulin. C. Increase insulin dose. D. Stop metformin. Answer: A. Explanation. Severe hypoglycemia requires IV dextrose or intramuscular glucagon if IV access is not available. Page 538, CTC 2018. Q10. A 59-year-old woman with diabetes and obesity has HbA1c of 7.9% on metformin alone. She refuses injections. Which oral agent is most beneficial? A. Pioglitazone. B. Sulfonylurea. C. SGLT2 inhibitor. D. Meglitinide. Answer: C. Explanation. SGLT2 inhibitors lower HbA1c, reduce weight, and provide cardiovascular and renal benefits in obese patients. Page 523, 2018. Reference